going through the observation phase and kind of finding needs is challenging on a few different levels. I mean, first, it is pretty tiring. I mean, physically and mentally exhausting. You're maybe in the cath lab wearing lead all day and really just focused on everything that's going around. So there's kind of a tiredness that goes along with that. But with that said, it's very interesting as well. So you're really engaged. But I think beyond kind of that component of it, just understanding everything that's going on and trying to wrap your head around so many different things. You may be going to different procedures throughout the day, and from day to day, what you're seeing can be very different depending on what kind of clinical area you're focused on. So just trying to wrap your head around everything, it can be a bit of a challenge.
I think one of the, frustrations or challenges that I had was the fear that you're going to miss something.
Yeah.
So I think that, from my perspective, I wanted to get my team in front of as many things as I possibly could. And I think what I learned was that, if you collect 200, 300 needs or observations, the breadth of what you've collected is significantly more than you ever imagined.
For me, the best part, again, is just being exposed to it, to the clinical settings, to the procedures, to what it actually means to treat a patient.
For me, it's thinking in a completely different way. So, when I understand those things because, I'm taking care of patients in a hospital, but I think what's most exciting about this part of the whole experience for me was that it's a chance to see and to change patients' lives in a completely different way than physicians do on a day-to-day basis. The advice that I would give anybody that's going and stepping into the observation phase of the process is to don't be shy. Ask questions all the time. Ask the nurses, ask your partner, ask the physicians, ask the administration, anybody that is sitting anywhere, ask the patient. Don't be afraid to ask them questions. Most people, I think, are, if you explain to them who you are, what you're doing, and what your goal is, most people are pretty open about it. I think you'll get a lot more out of it, and that interaction, I think, is really important. So don't be shy, and try to ask as many questions as you possibly can.
Yeah, and I think another component that's really helpful is just the concept of just start somewhere. Really just starting is the hard part. Once you're there, it's like floating downstream. You find so many things that just carry you along. You see that this procedure is interesting, but then you start thinking, why is this patient here? And so then you just kind of follow these little breadcrumbs throughout the entire hospital. And so it's really just start, and you'll be fine. Everything will follow from there.
Sounds like just start, ask a lot of questions.
Yeah.